Hello, I'm Lisa Richardson, Director of CDC's Division of Cancer Prevention and Control. CDC reached a significant milestone in 2021. The National Breast and Cervical Cancer Early Detection Program is turning 30. We will be celebrating that anniversary this year. We call it the BNC program. This BNC program was born from an idea raised by advocates in the U.S. with data and science in hand, who raised the need for making breast and cervical cancer screening available to low-income women. Congress responded by passing the Breast and Cervical Cancer Mortality Act of 1990. This law led to funding that allowed the door to open for CDC to create the BNC program. Screening began a year later. Things really took off from there in 1993. The program expanded to include American Indian and Alaska Native tribal organizations. Later, in 2001, a law was passed that allowed our programs to apply for a Medicaid waiver to pay for treatment. We use a lot of statistics when we talk about the program, but it isn't just about the numbers. Each one of the points you see on our charts and graphs represents a woman who received breast and cervical cancer screening, who might not have received it otherwise. I'm inspired every day by the impact of the work we do together. It's about the women. At CDC, we work with women through our programs. As a doctor, I still miss working with women face to face. But here we are, still making a difference, ensuring care for women where it's needed. I've been with the program since 1997. It's been amazing to see this program expand and reach more and more women over the years. 8 states have traveled with CDC from the beginning of the 30-year journey from 1991 until today. These 8 states, California, Colorado, New Mexico, Texas, Minnesota, Michigan, West Virginia, and South Carolina, are recognized for laying the foundation for what the BNC program is today. By the end of 1996, national program reach was achieved when CDC awarded funding to all 50 states, and we also celebrated providing over 1 million screenings to more than 675,000 women. Nearly 6 million women have been served. Among uninsured, low-income women, our program found 71,000 breast cancers and 4,800 cervical cancers that might not have been found. Who could have imagined in 1991 that millions of women would have been reached by the BNC program? Over the past 30 years, the program helped women and saved lives. And the BNC program continues on a path that increases health equity among low-income and minority women. Among the 1 million women provided breast services in the most recent 5 years, nearly 71% were minority women. Hispanic women represented over half of the women served. The program continues to change to meet the times. The BNC program is using population-based approaches to improve screening in clinics to increase high-quality breast and cervical cancer screening for all women. Lastly, I should mention that funding for the BNC program in 1991 led to the creation of CDC's Division of Cancer Prevention and Control and the resulting outstanding portfolio of work that we do today. I want to personally acknowledge CDC's current awardees who span across states, the District of Columbia, tribes and tribal organizations, Puerto Rico, and U.S.-affiliated Pacific Islands, continuing the good work that changes lives. Without the dedication of thousands of program staff, clinical providers, and others who lead the care of women, the success of our core BNC program would not be a reality. This has been a rewarding 30-year journey together. Needless to say, we could not have accomplished all that we have without working together. As we move into the next 30 years, I want us, you and me, to always remember the women we serve. That's what's important. That's where the value lies. More women screened, more cancers detected or prevented, and more women living longer, healthier lives. Please join the celebration of our BNC program and visit our website at cdc.gov/cancer.